the cost of early detection wasn't worth it. So
hello.
Namaste.
Hello. Shashikal. Hello, everyone. Hello, Ankit.
Namaste.
Namaste. How are you doing?
Fine. Welcome to IBS TV.
I am so happy to join you all because every day I've been listening to Dr. Saggu. This is happening, that is happening, and I'm so glad to meet you all today. Very nice to see you.
And we are all very excited to have you on our show, and you know that I'm trying to get you on the show. It's been a while, and finally you are there talking to us today.
Thank you, Ankit. I'm glad I accepted your request. I'm glad I'm here with you today evening.
Welcome to our talk show. And you know, such a blessed family, such a beautiful family to be serving the community the way you do as doctors. Thank you.
Thank you so much.
And two very important medical areas, because breast cancer and women's breast is, you know, has become such a profound problem, hasn't
it? Exactly. Breast is the important part of women's femininity. It maintains a body image, and having so many diseases with the breast, like it's such a big, shocking and distressing thing for a female to know this. I know.
So let's discuss some of it, because how long have you been as a doctor in breast cancer?
It's been more than 17 years.
You don't look that old. You don't look that old. So you're so beautiful. So let's talk about 17. Why did you choose breast cancer? Because this is a lot of study, right, and a lot of research. Why did you choose breast cancer?
Actually, I became surgeon as a choice. And during my surgery internship period, my father was diagnosed with cancer. And it was a stage 4 cancer. He had a metastasis in liver, and we could not diagnose the primary. And I, being a doctor, my father was never ill. He never had even a headache. He never went to a doctor during his whole lifespan of 70 years. And one sudden evening, I got a message from home. I was in my hospital, which is almost 200 kilometers from my home. And I got a call that my father is unwell and he's hospitalized. It was really a big shock to me that my father going to a hospital was a big thing. And I went to see the doctor straight away from my workplace. And the doctor told me that your father is in stage 4 disease of cancer. It was such a big shock to me. First of all, I couldn't believe, and I collapsed there. Being a doctor, I didn't know how to react, you know. And we lived in a very small place in Punjab, and there was no facility available for this cancer thing. And then I shifted my father to a bigger city, but he didn't survive. He just was with us for 2 days only, and he passed away after 2 days of the diagnosis. I was unmarried at that time. And I was in my second year of the residency of my surgery. And from that day, there's a guilt in my mind that I couldn't do anything for my father. And I wanted to do something in this field. And later I got married, and my husband, you know, Dr. Saggu, and he's a passionate laparoscopic surgeon, and he taught me laparoscopy. Actually, he taught me. He held my hand. He told me how to do the laparoscopy procedure and everything, and I went like very much confident in laparoscopy. But one fine day, my Guruji, we go to a Gurdwara, we do charity there, and I have a Guru, like, who is my father's Guru also, my grandfather's Guru also, and he sent me one patient who was very close to him. She was diagnosed with breast cancer. She was just 30 years old, a mother of 2 children, very small, and she lived in Nairobi. And he sent this lady to me. He said, you're going to treat this lady. And I was a laparoscopic surgeon, not very well versed with the breast cancer. So I got hold of a very good breast oncosurgeon. And with the help of him, we did the breast conservation surgery on that lady. And it went off successful. She's doing fine till date. This was done 17 years back, almost 15 years back. She's doing absolutely fine now. But that was the day I completely changed what I wanted to do. I thought we both are laparoscopic surgeon, both husband wife. We both are not. It's the same profession. We will be having competition in this maybe later in life. So I chose, and my inclination was towards breast. Slowly and slowly, I developed the interest into the subject. I left everything laparoscopy. I went to Tata Memorial Hospital. My husband was very supportive. I had twin daughters. He took care of my twin daughters and sent me to Tata to do a fellowship in breast surgery from Dr. Barbe, who's the big name, renowned name in breast cancer surgeries. And I was trained under him. And then I went to M.D.Anderson Cancer Center for some time to do an observership in the same field. And after coming from there, I'm attached to Apollo Hospital. It's been more than 10 years now. I'm with Apollo Hospital and serving breast cancer patients. This is my story.
Wow, that's a beautiful story. Oh my
Thank you.
goodness. And to continue doing what you do, because this is continued research. This isn't just doing surgery. You continue to research to find solutions. The surgeries have probably changed over the years, right? You know, how you practice. What are some of the things? Let's talk about because you live with this every day, your patients and everything. Breast cancer, has it become a bigger problem in the past, say, 10 years, 5 years?
Exactly. This is because, obviously now World Health Organization has, according to their data, now breast cancer is the #1 cancer amongst women globally. No, and the incidence is rapidly increasing. This incidence is increasing because we have now better modalities to diagnose breast cancer. We have better modalities to treat breast cancer. We can detect it early. There are so many screening programs coming here to make women aware about the early signs and symptoms of breast cancer. That is why we are detecting also early. Numbers are also increasing. But in India, the problem is more younger women are diagnosed with breast cancer. Their breasts are dense. We cannot diagnose them in a very early in dense breast because there is overshadowing of the breast tissue with the lump in the breast. And another thing is that women present late because of ignorance, maybe because of fear, maybe they don't want to go to a doctor. And in younger women, because of dense breast, they cannot find a tumor inside. That is why the mortality rate in India is slightly higher as compared to the Western population.
Wow. And you know, we know early detection, we can save so many more lives.
So many lives. I know.
And one of the problems here in the U.S. is similar to what you're talking about. Is most people who probably feel like they have it, they can't afford it, you know,
Exactly.
and so they ignore it. Another is sometimes it's hard to detect. You know, they teach you how to detect, how to feel for lumps. Like I have no good feelings in my fingers, so I really can never feel a lump. But when they detected one in a mammogram, they sent me to be monitored, right? So every 2 months they watch the growth. So these are, you know, but this costs money, and a lot of people they don't have that. So what are some good I hate saying this, cost effective ways, because a life is, you shouldn't do that, right? We shouldn't put cost effective on, but what are some good things that women can think about? And then we're going to talk about the difference of cancer, because I really want to get down into the inflammatory cancer versus others, and different ones that you have seen in your experience. But what are some things women can do?
About the screening methods, you very rightly said that the best screening method is a mammogram. But the problem with mammogram is the cost. And so in India, we don't have the screening practices, right? I think in US, you people have the screening programs, don't you?
Yeah, we do, but they're very expensive. We have 1 month, used to, I don't know if it still exists, but if you register in 1 month, they screen as many women as they can for free. So in the month of October, they will have women come in, and as many as they can. It doesn't mean everybody gets screened, but yeah.
Okay. That is, here also we have few centers, few bigger cities, we have vans where they carry the mammography machine and then they test the women for free. But it is done for only small group of women. It is not a mass screening. Mass screening is lacking in India. I don't know about US and UK. Because of this lack of mass screening, we are not able to detect women early. And only few women who have money, because it costs a lot. 2,000 to 3,000 Indian rupees is the cost of one-time mammogram, which is quite a big cost for a woman whose monthly income is maybe just a 10,000 rupees or 20,000 rupees. It is difficult for them to undergo this test. So, what in India, what we are making women aware about the breast self-examination. Right, breast self-examination is examining your breast with the two hands at your home. It is a simple procedure, and it does not require any cost. There is no equipment needed, and we are training women to examine your breast once a month, starting from the age of 20 years. Though it is not a good screening modality, it is just a woman should find a lump and should report to a doctor. The best method, obviously, is a screening mammogram. Second, we make them aware that go for clinical breast examination. That is examination by a doctor once a year when you are above 30 years of age. And if you're a high-risk woman, like you have any family member diagnosed with breast cancer, or there is a BRCA mutation positive woman, or a woman who has a breast cancer in one breast, should undergo this clinical breast examination more frequently, and mammography is mandatory for them after the age of 40 years.
After the age of 40, but we are aware that women before 40, like you experienced, the woman who was 30, some women in their 20s. So there you need to just be conscious about your family history and things like that, I'm sure. But let's talk about what causes cancer? What is the biggest cause of cancer?
Yeah, we exactly don't know what causes breast cancer. There are some risk factors which increases the risk of breast cancer. The risk factors, there are two types of risk factors. One is they can be changed. They are known as modifiable risk factors. If we bring changes in our lifestyle, we can modify our lifestyle and can reduce our risk from breast cancer, like being obese. Being obese is the biggest risk factor, not only for breast cancer, but for many other cancers and for cardiac diseases and many other diseases in our body. Second is excessive alcohol consumption. 1 or 2 glasses of wine a week is okay. But excessive alcohol consumption is a risk factor, because what alcohol does? Stimulates, sensitizes the estrogen levels in our body, which is a risk factor. Then third is cigarette smoking. Cigarette smoking is now becoming rampant among the teenagers, the younger lot group. And the teenagers who it sensitizes again for the increased levels of estrogen in our body. Then another one is like women are getting married late. They are following our Indian women are also following the Western culture. They don't want to get married before 30. They work, they want to earn, then they don't want to make children. They don't want to breastfeed them. So these are the factors which are really worrisome. Then some women take hormone replacement pills, especially after the age of 40 or after the menopause, either to combat the symptoms of menopause or to treat osteoporosis, which is not good, because that hormone replacement therapy has increased levels of estrogen, which is not good for breast cancer. So these are modifiable risk factors. When we can modify them, we can reduce our risk. But there are some non-modifiable, like they are within us. One is being a woman. Women have breasts, being a woman, the biggest risk factor. And the second one is the advancing age. As the age will advance, there will be more radiation to our genes, more mutations in our DNA, and more risk of breast cancer. Then if a lady has a personal history of personal history of breast cancer, then the risk to the contralateral breast also increases. Like these are few of the risk factors, but there is no one cause of the breast cancer which can relate that this breast cancer is happening because of this cause.
No, and I agree that these we can't get away from the unfortunately the first risk factor, which is we are women, so we have it.
We are
The
women.
other
Yeah.
thing that you discussed has always been a concerning point to me is all the hormone additives that they give you when we do start having menopause, which I've elected not to take the hormones. And
Yeah.
I will say that you know what. The symptoms are not as bad as I thought. Irritating, but not bad. And I've learned, one of my doctors told me if I stay healthy, exercise a lot, and he knew I always exercise. So he even told me, he goes, odds are you won't ever experience it. But that's not true. I did. But
Mhm.
it's, you know, we have to maintain a healthy body. But you mentioned something that was very important, and that's our natural nature course, right? We are women.
Exactly.
We are
Yes.
naturally, by nature, designed.
Yeah.
Baby.
But yeah, I want to emphasize here that men also get breast cancer. There are
Wow.
1% men also get breast cancer. There men also form. Yeah. There is milk ducts in the men which produces breast cancer, but the incidence is very low. It is 1 in 1,000 men can get breast cancer, and we do mammography also for men if required, right? And we cannot say that
Wow.
men are completely immune to this disease.
So, and you mentioned some things that are interesting to me that are factors of other cancers, which are the fatty, the extra fatty stuff that we take in, and obesity, which we talked about today, which is
Yeah.
a big factor of liver cancer. As well as other cancers. So, you know, your
Yeah.
husband and you kind of work in the same battlefield in many, many ways, right? It's to prevent these kind of cancers. But let's
Yeah.
talk about what exactly, so we talked about what the risk factors are, but what is inflammatory breast cancer? What is it?
Uh, yeah, there are many types of breast cancers, and inflammatory breast cancer is one type of invasive breast cancer. It is a very rare type of breast cancer, but it is a very aggressive breast cancer. The incidence is only 1 to 5%, right? And inflammatory breast cancer, it rapidly grows, rapidly spreads, and the symptom of inflammatory breast cancer, the breast becomes suddenly, there's sudden change in size and shape of the breast. It becomes larger, it becomes tender, it becomes swollen, and it becomes inflamed. Like the whole skin of the breast becomes inflamed. That is why it is known as inflammatory breast cancer. There may or may not be any lump inside. You may not feel anything inside, but the whole skin of the breast is inflamed. It becomes thickened, it becomes dimpled, it becomes red, it becomes swollen, and it is a very aggressive form of breast cancer. The incidence is more in US and UK of inflammatory breast cancer. In India, the incidence is very less, and usually they are diagnosed in an advanced stage, in stage 3 or stage 4. And the diagnosis of this cancer, it mimics like mastitis, like somebody has got inflammation of the breast, which sometimes goes away with antibiotics, and people keep on trying antibiotics as well, but there is no response to any antibiotics. So the only modality to diagnose is ultrasound guided, either a biopsy or a punch biopsy from the skin. We diagnose inflammatory breast cancer, immediately put the patient on treatment, a neoadjuvant chemotherapy, so that we can reduce the inflammation, reduce the whole of the breast should look okay and normal, and then we perform a surgery on them.
Wow. Okay. So that's and they need to. This would be a symptom that they could see then, right? That it would go, but that's pretty late stages. Am I right? By the time.
Yes, yes.
So, but there are probably ways, you know, again, mammograms, if we can get our mammograms in and things like that. At what point, say, if I feel like I feel something, who should I call first? Who should I call?
Whenever a woman finds a suspicious thing in her breast, whether it's a lump, whether it's a nipple inversion or a nipple discharge or a thickening of the skin of the breast or any lump in the armpit area, we must go to a super specialist doctor or a breast cancer specialist. Do not ignore the symptom. And I would emphasize here, please go to a right doctor, right? And avoid going to any homeopathy or Ayurvedic they say that we can treat breast cancer. Please, no homeopathy and no Ayurvedic can treat breast cancer. Go to a super specialist, get yourself investigated, get proper mammogram or a biopsy, and form a diagnosis. So that, because what we emphasize is that detect it early. If we detect it early, our journey is really, really very smooth. We will have a lesser form of treatment, lesser chemotherapy, no side effects of that chemotherapy, lesser radiation. Maybe we do not require radiation, or maybe we don't require chemotherapy, and we are cured of the disease. So, and the prognosis is very, very good when we detect it early. If we go to a wrong doctor, we are the time is like we are wasting our time, and during that wasting of time period, the stage of the cancer advances. So it is mandatory we should go to a right doctor, get ourselves checked, and make sure that we are in right hands and getting the right type of treatment.
Well, that makes sense. I mean, I don't go to a heart doctor when I injure my knee, right?
Yeah, exactly. And in India, like we are, because of embarrassment or fear, or we feel shy, we tend to find a female doctor who should examine our breast. And by the time we go to a specialist, we have already lost 1 month, 2 months, which is a very, very important period for us.
No, and I agree that we needed to be a little more on top of screening, early detection, because when you do that, the treatments might be less that you have to do to contain it. Again, I've kind of been through the process because the insurance companies, they don't like to just dive in and start paying for treatment. So they go, well, let's measure it for 6 months, right? And see how fast it grows. And I go, can't we just take it out? Why are we measuring? Why are we testing? Why can't we just remove it? And they go, well, let's just, and, so then we did that, and then it was growing fast. And so they decided surgery, right? Let's just go ahead and remove it. So, but surgery is not always the answer. Am I right? There are other.
Exactly.
So share with us some of the processes that can happen. What are the options?
Options of treatment. So if the breast cancer treatment is a multimodality treatment. Surgery is not the only treatment required. We feel that we have removed the lump, or we have removed the whatever abnormality was there in the breast. Now, why do we need the further treatment? Treatment of cancer is a multimodality treatment, which includes surgery, a right kind of surgery, whether a complete removal or a breast conservation surgery, followed by chemotherapy or a radiation therapy, or a targeted therapy as well, which consists of Herceptin if the person has a HER2 positive cells, or a hormonal therapy for 5 to 10 years if the patient has a ERPR positivity. So the treatment options will depend upon person to person, and treatment options are personalized and customized according to the patient's stage of the disease, grade of the disease, the type of tumor it is, how many lymph nodes are involved, what is the ERPR status of the tumor, what is the HER2 status of the tumor. So many factors decide what type of treatment will be given to a particular woman. So no one type of treatment is not given to everyone who's diagnosed with breast cancer. So that is the point here.
No, and then that's what, the thing is early detection. And it doesn't hurt to make a relationship with a breast cancer doctor. If it comes up negative, that's great. I mean, that's
the best news. That's the best news you can get. I know, because 80% of the lumps in the breast are normal. They are benign. So don't worry that if I have a lump in the breast, it is always a cancer. No, there's no need to panic. Go to a specialist doctor, get the biopsy, and maybe it is a benign tumor for which you do not need any kind of treatment. The message here is detect it early, go to a right doctor, and get yourself treated. That's it.
And that's, and that should be with anything. That shouldn't just be breast cancer, folks. I mean, that's anything. If you detect something is wrong with you, if you feel a lump in your chest area, maybe start with the breast doctor, and then they can go, you know what, you really need to go see a skin doctor, or you need to start with using your smarts. And We talked about some of the possible treatments, and unfortunately in medicine, sometimes some treatments, they have side effects. So what are some of the side effects of the treatments that we're
Yeah.
talking about here?
Yeah, the main side effects are with chemotherapy and radiation therapy, and the side effects will depends upon the type of chemotherapy drugs and the doses of chemotherapy drugs. And each patient will have different types of side effects. The main side effect with chemotherapy is loss of hair, the alopecia, which usually happens in 90 to 95% of women, right? That is the main concerning effect when woman goes bald and she doesn't like it. That is the main thing. Then there can be vomiting, there can be nausea, there can be pain abdomen, there can be fever because of the low counts in the blood, there can be constipation or diarrhea, but there are very mild symptoms. Nowadays we have so many good drugs, we give pre-medication before the chemotherapy, so all the side effects are very less as compared to the era, a decade or 2 decades back, when we used to have so many side effects with the chemotherapy. And with radiation therapy, there are in the initial stages, there can be redness of the skin becomes darkened, or there can be superficial burns over the skin, or if it is a breast conservation surgery, the skin becomes thickened, hardened, but eventually these all side effects are reversible. They are not permanent. Here comes, the skin starts glowing, the numbness in the hands and fingers goes away, and you look absolutely normal after, you can say, 3 to 4 or 6 months after chemo and radiation. All the side effects are reversible, so there is nothing to worry. Don't panic. You will get your normal skin, normal hair, and you will look beautiful as ever, as before starting the treatment.
Yeah, and that's the thing right there. Just like other parts of our body that we learn today kind of regrow. We learn the liver
Yeah.
regrows, the skin regrows, right? We recover. There we go. I don't know. Is this a typical what you would consider a good description of the types of breast cancer?
Yes. Perfect. The most common type of breast cancer is a ductal breast cancer. This is an invasive ductal carcinoma. It occurs in the milk ducts, right? And the second commonest type of breast cancer is the lobular breast cancer, which occurs in the lobes. You're showing the milk gland. These are the lobes of the breast, which happens in the, this is the lobular carcinoma. Then there is a mixed tumor breast cancer, it can happen. Then there is a mucinous. Mucinous breast cancer is a type of ductal breast cancer, invasive ductal breast cancer, and has a very good prognosis. Yes, very good picture.
No, and it helps to have the pictures so that we can understand what's going on. With this being the one of the number one causes of medical problems and death is probably, I can't imagine the cost of this on our countries. It's not just India, okay? It's a global problem. Women's health in general is a global problem that we need to address. And one of the reasons is because of poverty. Majority of the women do not have the sustainable income to maintain a healthy maintenance, just healthy maintenance, right?
Yes,
And we need to change that. As a team, I think it would be great globally. We talk about the WHO, the CDC, and all of these companies and organizations that are funded by our governments. I don't really, they talk about it. I don't see any wheels spinning, right? With all the money invested, you would think that there would be some more answers for you to be able to treat more patients, right? And that would be nice. That would be nice to get more answers for you. What are some of the tools? It cannot be inexpensive. You're talking about a mobile screening van, right? And it travels. This is going to be very expensive.
Yes, it is. But India is a developing country, and this is the financial constraints are the major problem in India. Dealing with breast cancer, once a breast cancer treatment, I think it costs 4 to 5 lakhs. If it is Herceptin negative tumor, and if it is a Herceptin positive tumor, it may cost up to 10 to 15 lakhs, which is a very, very huge cost to the pocket of a middle class family. And but we have good government hospitals. There are many charitable charity organizations which are helping people. But still, women who are from a very low socioeconomic status, they don't want to come up. They don't want. They just hide and sit at home with the disease in their breast, because they think that it's a very long treatment. It's a very costly treatment. They are going to chop off my breast. How will I live? How will I survive? So the issues are there.
So because of what I do, and I as an entrepreneur, I get reached out to by a lot of people with new technologies and ideas. And everybody has a reason why they get involved. Just like you shared your story. Why did you become a breast cancer doctor? Why not something that, and it's got to be happy endings, but I'm sure you have a lot of sad endings, right? And the sad endings generally come from the fact that we did not early detect. Am I correct?
Yes, absolutely.
The other sad endings are probably the women who choose not to do one of the options, right? And maybe it's because they can't afford it. Maybe we can fix that problem. I think as a global community, we can start fixing that problem. But early detection, that has always been in my mind, why can't we do more? And so there's a thing called screening, right? Kind of like pregnancy screening. You have the at-home test. It's not 100%, but if it tests positive, you could do what? You go see a doctor, right? An OBGYN. So what if we had an at-home screening that maybe wasn't just feeling and checking, but an at-home scanning, not 100%, but says, hey, there's a reason you might want to go see a doctor. Would that be worth it?
Yeah. At home screening, right now we have just two hands.
But what if we come up with a means to, and what happened is these people came up with, and it's still in test, but can I share it with you? It's an app for at-home screening. It's not 100%, but when I heard you were coming on, I wanted to share it with you. Again, it's not finished, but it's for conversation. What if we can do something like this? And can you share it? Can you share it? I can't hear anything. Can you fix it? Can you fix it? We can't hear it.
Impact. 98% of women who detect breast cancer
can
have a positive impact on their diagnosis. Today, there are many tools available to help women promote better breast health, and you should see your doctor to find out what is appropriate for you. Now, thanks to the team of doctors at ThermoGo, there is another tool to help women take control of monitoring their breast health. Introducing Stay Abreast Early Detection System, a new, non-invasive smartphone-based app that gives women of all ages the power to detect signs of spotting physiologically similar tissue to breast cancer early, in the comfort and convenience of their home. Stay Abreast EDS utilizes infrared thermography, or thermal imaging, to detect hotspots within the breast. Thermal imaging is the earliest known form of discovering physiologically similar spots to breast cancer, and the doctors behind the development of the Stay Abreast EDS app are some of the most experienced with thermal imaging technology in the world. Stay Abreast is easy and convenient. It quickly installs on your Apple OS or Android smartphone. When connected to the included IR thermographic camera, Stay Abreast EDS uses thermal imaging to analyze your breast and identify possible areas of concern. Once you take a photo of your breast, the Stay Abreast EDS app removes any semblance of your body or breasts from the photo. Blockchain security and image manipulation means your information is secure and no potentially embarrassing photos are kept on your phone. Stay Abreast takes no more than 6 minutes to complete and is 100% radiation free. Stay Abreast EDS provides women of all ages the peace of mind that they are doing all they can to promote better breast health and live breast cancer-free. With your contribution, Stay Abreast EDS can fulfill its global mission of becoming the front line of spotting physiologically similar breast tissues to breast cancer in women around the world. So join the Stay Abreast team to receive early access to the app and exclusive discounts on pricing. Stay Abreast EDS, monitoring your breast health in the comfort of your home.
Now, I want to do a disclaimer. First off, this is all science and technology that is evolving and research for the good, for quality of service. It is also not intended to be a breast cancer detection,
Exactly.
early detection screening system. It is not to replace your doctors, okay?
Exactly.
Something like this, cost effectively, if it evolved, could help you.
Maybe. Yeah.
You know, for people like me who don't have good I don't have feelings in my fingers because of a spinal disease. It's hard for me to feel the lumps. When they told me I had a big lump there, I couldn't feel it. As soon as you can't feel this, and I go, no, I can't feel it. So,
and sometimes, we have to really poke inside to feel it. And sometimes it is so deep seated, we have to really poke inside. We can't feel it.
And it's all that, and I'm gonna tell people, you know, I hate bringing this up on national TV or international. It's breast is fat, okay? So you got to feel around fat, okay? Have you ever felt around fat in a chicken? You can't feel anything with fat in a chicken.
Exactly.
I hate using that as an example, but that's the only other cold meat I've felt around, you know, trying to clean out a chicken or a turkey. But I'm sitting here going, you know, so. But all that is if you've ever played with infrared scanning, which I have done many times, you know, you can see the different heats in your body, right? So what you do is you just learn different parts of your body in the infrared. Artificial intelligence will take a look at things, and maybe you get a baseline, right? And then the AI will watch, hey, this baseline big spot seems to get bigger. You need to go call your doctor. And again, it's not meant to replace your doctor. It's just kind of meant to replace this, right? But tools like that could help. They're very cost effective once they become an app. That camera, that camera right now, you know, is very expensive because it's in prototype stage, but it's intended to cost less than $200, less than an iWatch. When it goes out to market.
Let's see what,
just something, and maybe I can send it your way to play with. Maybe I can let you look at it and play with it. Again, that's just one. There are thousands of them, right? There are thousands of people trying to come up with an answer. But I think majority of them is because they've had somebody die of breast cancer that get early detection, and they go, why not? You know, so go ahead, Ankit.
Yes, Ankit.
So, ma'am, can we have a mobile mammographic machine so that it's easy for us to carry it wherever we want and we can get the testing done?
Yeah, we discussed. Yes, we discussed. We can have. But I don't know what is the film quality of that mobile mammography machine, because now we are coming up with digital mammograms which have lesser radiation, better film quality, and we can better diagnose it, the small calcification stage 0 disease. Now we have another new evolving technique, that is the DBT. That is a digital breast tomography, tomosynthesis, right? This is a 3D mammography, which is now becoming very, very easy tool to diagnose breast cancer in younger women who have dense breast. It's a very good screening tool for younger women. So we are evolving with the new mammography machine to pick up the cancer early, and to increase the sensitivity and specificity of mammography, because simple mammography film sometimes doesn't tell us anything.
No.
10 to 50% of time, it cannot detect cancers. Mammography mostly cannot detect lobular cancers, cannot detect sometimes inflammatory cancers. So mammography is not a 100% sure shot answer to everything. right? We have to be vigilant. We have to we have to go to a doctor. We have to be vigilant enough. No, but
when they detected potential situation, they didn't go to the mammogram. They went to ultrasound and what you're talking about. They went to digital mapping and screening as opposed to a mammogram. So, and then they would have me do both. And I don't know if they were thinking, which tool works better, but I would.
Yes.
Yeah.
Yes. And in younger women in India, we are doing, even MRI is a very good tool, but MRI is equally very costly. And MRI, the woman has to lie prone. There has to be contrast should be given. A breast coil is must to do an MRI. It's a very costly thing, like 3-4 times to the mammography. But sensitivity of MRI is excellent. It cannot miss cancers. Right? We have many screening tools, many imaging methods, but the cost then comes in our way.
No, and the thing is like the ultrasound that they were doing when they finally realized that might be the best way and they were measuring it. To me, that was the most comfortable. All right, all the other like the mammograms and stuff like that was not comfortable.
Yeah.
But the ultrasound was to me. But each tool detects something different. This is what I tried.
Exactly.
That sometimes they have to do different tools to figure out.
Yes.
Because each cancer is different, right? There's more than one type of breast cancer.
Yes.
And and I know that one of the things they did before they, what do you call it? They took out a sample. They injected radiation seed, right? So they injected a radiation seed to see the growth better. So they implanted radiation seed next to the cancer. I thought that was interesting. But I learned a lot. I don't know everything, why they do everything, because I didn't want to ask too many questions because I know they're busy. You guys are busy, right? So having these kind of conversations on TV are probably helpful. But so another question is if I have breast cancer treatment, can that be dangerous for me to have a baby, or should I wait? Is there a time I should wait to have a baby?
Yes. If the lady is unmarried, if she's nulliparous, if she wants to have children after the breast cancer treatment, she must discuss with her doctor about preservation of her ovaries, because the chemotherapy damages our ovaries to some extent. The damage can be a permanent or it can be temporary. If the woman is really young, the damage might be temporary. She might resume her periods after chemotherapy or a year later, and she can start forming eggs and she can conceive. But we always take a fertility specialist consent, and we send the patient to a fertility specialist. She counsels the lady about ovum preservation or an embryo preservation if she's married, and then we start the treatment. But there is little bit delay in starting the chemotherapy because of this, because they have to mature the eggs, then take the embryo, fertilize the egg, then take the embryo. It takes almost 1 to 2 months, and the treatment is slightly delayed. Then we also have GnRH analogs, which slightly preserves the function of the ovary. So the main emphasis here is to preserve the function of the ovary. We really do the counseling with the lady and with her husband that these are the treatment options. What do you want? It is must. It is really criminal if we are not discussing these options with the family and the couple.
No, and that's, and I guess that does become a conversation between the patient and the doctor.
Exactly.
Because those are a lot of things to take into thought. Because of my age, I don't consider those kind of things anymore. But when we talk about,
but if the lady wants to become pregnant, if she wants to conceive after the treatment, she can go ahead with that. I have a couple of patients who have taken the whole chemotherapy, whole treatment of breast cancer, and after 2 years they have planned pregnancy, they have conceived, and 2 of my patients, they have children, grown up children after the breast cancer treatment. So it is not a big thing, but you have to really plan everything beforehand.
Right. So another question, actually, because it came to my mind when I had to have all of the surgeries, is you know, there's a lot of guys here, but one's a doctor. The women, you know, this is our breast. Our breasts are pretty. The surgery can be very invasive at times. Used to be, right? Very, but now the surgeries have changed. They're not as damaging, but it can just really destroy the skin. It doesn't look nice. So, what you know, what would you say to a woman? And I know we should always put our health first, but how can you tell a woman we can do this better? You know, what are the effects of the surgery physically?
Yeah, see, breast cancer, the word breast cancer is really, really, really disturbing to the woman. It is concerned with her femininity, with her body image, with her sexuality, right? Breasts are very dear to a lady. It makes a woman, right?
Right.
Telling her that we are going to remove your breast because of the breast cancer is the most annoying thing a lady wants to hear. We have so many good options now. The medical treatment has there are so many advancements been there in the surgical treatment now. We preserve the breast. We tell them, if you come to us early, we will just remove the lump along with the margin of the normal healthy tissue, and then we will rearrange your breast tissue, do an oncoplasty, so that you can have a similar looking breast as compared to the contralateral breast, and you don't need to lose your femininity. You can go home with your normal looking, cosmetic, good looking breast. So this makes them happy, this makes them cheerful, this makes them really a woman, that I am not going to lose the breast even if I have a breast cancer. So reassuring her that breast cancer treatment does not now mean that we are going to really remove your breast, give you a bad breast scar, give you a flat breast like a man. I had one patient who had the breast cancer in both the breast, and her one breast was removed almost 20 years back when I was only studying, and she came to me after 10 years, and then again she had extensive breast disease, and we had to remove her breast, and she said, "No, you will make me a man. My both breasts are gone. I'm a flat chested. What should I do?" We have so many options. If the woman does not want to go for reconstruction, we have artificial implants. We have external implants. They are silicone implants. The woman look absolutely normal after wearing them. We have lots and lots of options nowadays. So no one should worry about this, that I am losing a breast, I will now transform into a man. It's not like that. Woman can maintain her body image, maintain her femininity, and maintain her confidence that she is a woman.
And I thank you for sharing that, because that was a big concern of mine. And when I heard that, but now you're not just a breast cancer surgeon, you're a plastic surgeon too. Like you can reconstruct. You're like a plastic surgeon too. Like you can reconstruct the breast, and you can do so many beautiful things. You don't have to walk out scarred up anymore. It's hard to hear, Ankit. We're losing Ankit. We're having feedback.
Hello.
Hello.
Yes.
So we just experienced a severe earthquake in Delhi.
Yes. Everything is shaking. Yeah.
Yeah, everything is shaking, and I was surprised. So I was just checking my family. Everyone is safe or not?
Yeah. Same here.
Yeah,
Wow.
it was
Okay.
a severe earthquake, and I believe it's more than 5 Richter scale. I mean, I'm just waiting for the
Yes. Yeah. I
news.
can see my table was moving. Yeah.
Yeah.
Oh, wow. So anyway, this has been a beautiful conversation, because so many times we concern, but you're right. This is what makes us a woman. This is very scary anytime you have any surgery, right? Because you're scarring. I had my appendix removed, And when the surgeon sewed me up, he did a quick job, right? It was an emergency. And he left this big lump on my tummy, right at my belly button. Big, nasty lump, right? Like it looked like a worm crawling across. And it was there for 10, 15 years. And my OBGYN felt so bad. He goes, that should have never happened. That you shouldn't have had this big, ugly scar. But it never bothered me because I lived, right? That's okay. That's my memory for living. So kid you not, when he got the opportunity to have surgery on me again, like for my ovaries, he goes, I'm doing it. And he went. He went and he removed that scar. He told me, women like to look beautiful. I said, but it didn't bother me. This is what I told him. At first it did. And I realized it's just part of life, right? And if it looks ugly, it doesn't look ugly to my family because they go, she lived. But I have to admit, I was a lot happier when he got rid of it.
Exactly.
But he told me, I'm going to do the surgery so I get rid of that scar.
Exactly. Yeah, no scars on the body, please. No woman likes a scar on her body. Yeah.
No, there's no reason now today. There's really no reason.
Yeah. In the breast also, even if we are doing benign surgery for benign breast tumors, fibroadenomas, for anything, we give a very cosmetic scar so that it is not visible to a woman.
Yeah. Things have really changed a lot. Like you said, they no longer just remove the breast and leave you flat. They don't do that anymore. And that's why
not at all.
Yeah, and we talked about that. How long? So this is, I guess, another question that has come in. But how long, for most part, after certain treatments, and maybe it's based on the type of cancer and the stages. But say you caught it in second stage. What are the odds, and how long can a patient expect to live? Is there a life expectancy?
Yeah, the prognosis will depend obviously upon the type of tumor, upon the stage of the disease, right? Stage 2 cancers, if it is a grade 1 cancer, if it is a strong ER/PR tumor, then probably women will live her normal life. The prognosis, they say, is more than 85% for 5-year survival rate. If the woman has a triple negative cancer, which are very, very aggressive tumors, if she has a HER2 positive tumors, which are also very aggressive tumors, and if the lady is young, and then the prognosis is little bad. So we cannot assess the prognosis just upon the stage. We have to see all other factors. What is the age of the patient? What is the grade of the tumor? What are the ER/PR status of the tumor? How many lymph nodes were involved? Like everything collectively, and then we can tell that the prognosis of this lady is like this.
No, and that's lovely. That's lovely. Yeah. And I would hope that we can have this talk again and talk more and have other guests on as well to talk about the different engagements of how we are changing strategies moving forward, the research moving forward, other questions. And it brings to my mind, because of Dr. Gupta, who's joined us, is, what kind of pain can a woman expect to experience in different stages of cancer? Maybe that's a conversation we can have. Is, I'm certain in different stages, there's certain pains that women might have. And, that is a full different conversation, I know, moving forward in a different plateau. But that's why we have Dr. Gupta on, is to talk about the different ways of treating pain and for different pains, right? And but what a lovely conversation we have. Do you know Dr. Gupta? Dr. Gupta, do you know Dr. Saggu's wife?
No, I'm meeting her for the first time.
Okay. So she's actually her own doctor. So we shouldn't even say Dr. Saggu's wife. It's just Dr. Saggu is our family. So but she, by all means, should be introduced as her own person, and a fabulous.
I'll tell you, everyone knows Dr. Saggu. That's why we have to introduce like Dr. Saggu, and then we have to say.
Right.
Everyone knows Dr. Saggu.
She is related, but the last name is the same.
I'm happy to be called Mrs. Dr. Saggu.
I can tell. What a lovely family. Wow, what an introduction he gave you. He has a lot of respect for you, and that is awesome. That is awesome. But we talk about, all of these different things that we go through. Even treatments can be painful or cause some pain, cause nausea. Sometimes it's not intended to, but that's just the risk we take for the benefit of surviving. But there are ways to treat pain, and that's where we have these conversations here is how do we deal with the pain? Because sometimes if you have to deal with too much pain, you don't heal, and there's pains, different variations. Like there's the pain mentally that we suffer when we're going through finding out that we have cancer, which can be devastating enough as it is. Thanks to technology and medicine advances and doctors like yourself, we're able to say, okay, there are options to survive, but sometimes those options are painful. And, Dr. Gupta, do you ever treat in pain? Do you treat patients that maybe have breast cancer or are going through a cancer treatment?
Yeah, a lot of them. So most of the patients who are ongoing treatment are suffering from pain. So it depends on the stage of the tumor, and we are generally relying on the extent of the disease. So if it's initially restricted, not much involved, so we generally manage it with simple painkillers like tramadols and paracetamols. But yes, if it's invasive, it invaded the bone or metastasized to the other parts of the body, then we might need to do some interventions to treat them or start them on opioids.
Oh, wow. Okay, so
But
there
yeah,
are various different, but again, this is what I tell people, that any kind of cancer can cause pain. Some doesn't. Some you don't even know you have it, right? It's just there. But treatments can cause pain. But these are things, risks that we take to move forward to get healthy. But you have to mitigate pain so that you can heal, so that you can sleep, because rest is very important, and relieving the pain is important. Opioids is a big problem in this country. Probably the last thing that you guys resort to for most of the pains. But what are some of the examples of treatments that give examples of some treatments women can do while they're receiving treatments? Just things that we could do mentally to relax ourselves, maybe not be